on the door and they locked the door. And the pastor sent word and said, you made us wait, you wait. I'm outside with my mama, my baby, and Tina has her baby. And we literally sat outside for about 25 minutes.
Get up and don't miss a minute of Get Up Mornings with Erica Campbell.
Get up. Get up.
On Praise AM 1310 and 95.1 FM Indies Inspiration Station.
Romance, lies, deception, accusations, true stories. Are you a true crimes junkie? TV One's True Crime Monday is now available every day and everywhere you listen to podcasts. Crack the case with us. Listen to the suspense-filled true life crime stories of love gone wrong on the all-new Fatal Attraction podcast from the Urban One Podcast Network. Listen and follow wherever you get your podcasts and urbanonepodcast.com.
Get on up and say that what we need for unity in the community. Get on up, yeah. And say that
3, 2. All right, good afternoon, everybody. Welcome to Unity in the Community. I'm your host, Pastor James Jackson. We got new digs down here. Monument Circle, how about that? We moved from 21 East St. Joseph, where we have been for a number of years, and we're now back on Monument Circle. Of course, we used to be down here in the early days, but we're back. It's wonderful. AJ is here in the studio. I can see him. No glass separating us now. He's right here in the studio. It's a beautiful Saturday afternoon in the capital city. We're also streaming on the Praise Indy Facebook page, as well as my Facebook page and YouTube. So welcome from Indianapolis and wherever else you are tuning in from. Thank you for being our guest on today. And hope you had a Merry Christmas. And in advance, Happy New Year, because by the time I'm back on next Saturday, we'll be in the new year, 2024. God has kept us over these last 300 and some odd days that we have been living in 2023. Every day has been a good day, no matter what kind of challenges that you might have had. To God be the glory for all the wonderful things that He has done. We are here and you are here. It's going to be a great show on today. Joining us in just a few moments is Michelle Latimore. She's going to be talking about Medicare, which is something that you're going to need. Even if you don't think you need it right now, you're going to need it very, very soon. It'll be very, very helpful to you. And she's going to talk more about that in just a little bit. Let's have a word of prayer. Father, we thank you, we praise you, we magnify you for all the wonderful things that you have done. You are good and your mercy endures forever. We thank you for this time that we have to gather together and to share with our listening audience and those who are viewing. We thank you, Father, for your grace, your mercy, your power, and your strength. We thank you for health care. We thank you for Medicare. We thank you for all of the healthcare professionals. We pray, Father God, for seniors who perhaps are not aware of the many benefits that are available to them. And we pray that this show today will help our seniors and our community to connect with the care that they need. And we give you praise and glory in Jesus' name. Amen. So I'm looking for the phone number. I think it's probably on this thing here. Yeah. All right. So we have a new phone number. You know, for years, we have had you calling 317-239-1310. Of course, that's not the number anymore. I could give you that number in my sleep. But this new number, I've got to memorize it. And I want you to memorize it. Put it in your phone. I have it in mind. 317-972-3008. That's 317-972-3008. Probably the best way to remember it like that. That's 317-972-3008. Praise AM 1310, Indies Inspiration Station. We are here to inspire you on this afternoon. I'm going to give you that number periodically throughout the show so that you can be connected on today. Michelle, welcome to the studio.
Good afternoon, Pastor. Thank you so much for allowing me to be here today. I appreciate you.
It's good to have you. And hopefully the people can hear you. I didn't hear you on my headset here. So, and you said you can't hear either. Can you?
I can hear you now.
You can hear me now?
Mhm.
Okay. All right. So, if you would give that greeting just one more time.
Good afternoon, Pastor. Good afternoon, listeners. My name is Michelle Latimore, licensed insurance agent here in Indiana as of right now. I I work with Medicare supplements, Medicare Advantage plans, and all those wonderful insurance plans that come available when we turn either 65 years of age or when we are been on disability for 2 years, then we automatically go into Medicare. A lot of people don't know that.
So you automatically go into Medicare when you turn 62.
Well, no, actually, when you turn 65, you qualify. You're eligible. I'll say that word. You're eligible for Part A. We're all eligible for Part A as long as we've worked at least 10 years in the United States or have at least 40 units with Social Security. You're automatically eligible for Part A. Part B, we have to qualify for it we apply for it either 65 or if you're still working and you have insurance under your employer. You have credible insurance, you don't have to go under Medicare at that time. You can wait and do that when you retire. And if you are on disability and have been on disability for 2 years, that 25th month, you automatically go into Medicare.
All right. So you mentioned Part A and Part B. Can you say more about what Part A is and what Part B is?
Okay. So we have Part A, which is for hospital. Part B is for everything outside of the hospital. Part A covers inpatient in a hospital, inpatient care in a skilled nursing care facility, hospice care, home care, and inpatient care in a religious non-medical healthcare institution. Mm-hmm. And that is what that's what we are eligible for as long as we have worked in the United States, again, for 10 years or more. There's no monthly premium for that. Again, we qualify for that. Part B, as in boy, is what we actually have to apply for. Again, when we turn 65, that covers medically necessary services from doctors and other healthcare providers, outpatient care, home healthcare services, durable medical equipment like wheelchairs, walkers, hospital beds, and equipment, and preventative screenings like shots, vaccines, wellness care.
And that's Part B.
That's Part B. Part B for 2024 will be $174.70 per month. That's the monthly premium. We pay a monthly premium for Part B.
So Part A, you don't pay anything.
You don't pay anything for Part A. Unless you go to the hospital. Mm-hmm. If you're in the hospital for 2024, that amount, your deductible is $1,632. So there's no monthly premium with Part A. I'm going to make that clear. No monthly premium for Part A. But if you go to the hospital and you are admitted, the amount for 2024 is $1,632.
So
that you have to pay out of pocket.
Yeah, which is not bad. But based on, given what hospitals charge now for services, I mean, one pill can cost $1,000.
Yes,
easily.
Absolutely.
And some of the other services, an IV and all that sort of thing, of course, they automatically put you on an IV when you go in there.
Absolutely.
And that can be $1,000 right there. But so there are a lot of people who probably qualify for Part A who are listening. And what would you say to people who are working and they have insurance, mm-hmm. And they say, well, I don't need that because I have insurance?
Well, I would say to make sure that, for example, there's a monthly price for Part B. That's $174.70. Mm-hmm. You have to look at what you're paying with your current employer. If what you're paying with your current employer is more than that $174.70, it might be smart to at least talk to an agent and find out what would be best for you cost-wise.
Mm-hmm. That's good, because if you're paying, if you go on Medicare, you pay anything. So nothing is better.
Absolutely.
Well, except for the $174, which is still not bad for all of that care.
A lot of people are surprised, not really too happy, not knowing, mm-hmm. Unfortunately, that there is a price with Medicare. We've paid into Medicare all of these years since we've been working, mm-hmm. and we think that Medicare is going to take care of everything. And unfortunately, it takes care of your medical, and it can take care of your doctors and things like that, as I mentioned, but it does not cover, traditional Medicare does not cover dental, vision, hearing, any of those things, which we are used to when we are retiring from a company. We're used to having a package, a plan that covers medical, dental, vision, hearing, and everything else. When you get into traditional Medicare and you have just the red, white, and blue card, that only covers Part A and B. You have to purchase Part D as in David, that's prescriptions. You also have to purchase your own dental, vision, and hearing.
So how many parts are there in this thing?
So Part A, again, hospital. Part B is medical. I mean, every doctor's office and everything outside of the hospital. Part D is in David, is prescriptions. Okay, so then the government came out with Part C, which is the Medicare Advantage C plans, which you see all the commercials on TV with JJ from Good Time and Joe Namath. Those Medicare Advantage C plan is Part A and Part B and Part D, all into one little package with dental, vision, and hearing. The reason why they did that, if you listen, Part A, there's no monthly premium. Part B, there is a monthly premium, pretty much $175 this year. Goes up every year, a couple of dollars every year. Then you have Part D. The average prescription drug plan for Part D is $55.70. So now you got $175 plus $55. Then you have to pay for your own dental, vision, and hearing. The private insurance companies like the Humanas and United Healthcare, Anthem, Aetna, all of those companies came up with Medicare Advantage C plans where they cover everything. It's a nice little package with your A, your B, your D, and your dental, vision, hearing. For mostly here right now, for the plans here lately, $0 a month. Everybody still pays Part B, no matter what. You always have to pay the Part B. But the plans are now $0 a month with some extras.
So folks who have at least worked 10 years in the United States of America, and the age that you qualify for Part A is 65 automatically.
You should receive your card in the mail. Here lately, since COVID, I will say it has not been as routine as it should. Sometimes you might have to call Social Security. I know people don't really want to make that phone call. The best time to call is on a Thursday or Friday, right at 7:58 when they open in the morning. So you only have maybe a couple minute wait.
Thanks for the wisdom.
Yes, a couple minute wait. But you should automatically get your card. If you're still working, it's only going to have A on there. Then you have to qualify for B whenever you decide to retire. Also, something very, very important, there are lifetime penalties. They're not just a one-time penalty. Unfortunately, I've had a couple people when they've gotten their cards in the mail, they're like, oh, I'm not 65 yet. I'm going to throw that away and deal with it later. There's a penalty for not applying.
Really?
10% every year that you don't apply for Part B as in boy is a penalty to you. So for an example, I had someone that is 70. He never got Part B because he's wasn't interested in getting it. Healthy gentleman, didn't have to. Now he needs it. It's going to be $17.47, which is 10% of $174.70 times 5. That's about $65, if I'm not mistaken, off the top of my head. You add that to the $174.70, that's his amount.
Per month?
Per month, this whole year. When it increases next year, it'll be whatever that 65, that little 65 is sitting in a pocket over there forever.
So it never goes away?
It never goes away. Yeah. It's lifelong.
That sounds like one of those timeshare things.
Yes, it's lifelong, and it's very much a shock. People are very, very upset about it, very shocked about it. And Part D is a 1% per month of not getting Part D as in David. So
when you turn 65, and are you encouraging people to get out in front of this early?
Yes.
So kind of take us or walk us through that. Perhaps there are some folks who are turning 60 next year, and they've got 5 years to go. Or maybe there are some people listening and they're 64. What would you say to those folks at this point?
I would say, since Medicare is so different than what we're used to when we're working with an employer, I would say getting educated on it maybe 2 or 3 years prior would be good. And to actually enroll, you have 3 months before your birthday month, and 3 months after your birthday month to apply for Medicare.
Okay.
Okay. So you got a not 8-month window there, or 7-month window, excuse me, 7-month window. It is suggested that you do it the 3 months prior, because Social Security might not get to it as quick enough because everybody's applying. And if it's late, that 10% penalty will be yours.
So after your birthday, when does the penalty kick in?
The penalty kicks in after that 7 months of you not applying.
After your 65th birthday.
After your 65th. So that 3 months after your 65th birthday, if you've not applied or showed that you've applied, then that 10% will happen then.
So how would people know that if they get this card in the mail? Is it written somewhere in the documents, or is this just something you're telling us because you know about it?
Well, there's a Medicare and You book that's about big as, remember the phone books back in the day? And it has it in there. It's probably about 200 pages, and it's somewhere in there. We don't really read through that.
Read that? Yeah.
Unfortunately, they don't tell you that in the commercials. They talk about all the extras and all the benefits, which are great, but they don't tell you those small little details. So I like to do a Medicare 101 with folks and just introduce them to it. Again, I would start talking about it maybe about at least a year. I said 2 or 3, but maybe a year, just so you can remember it. Maybe 3 times before you actually sign up, because it's a long conversation when we sit down for the first time and you're brand new. It's a very long conversation.
And how can people get a hold of you who may want to avail themselves to the Medicare 101 kind of orientation, if you will?
Okay. My contact number is 317-378-7420. Again, 317-378-7420. The name of my company, and I'm so sorry I didn't mention this in the beginning, is Elevate Life Health Solutions. And that's Michelle Latimore only as of 2023. I'm God is a good God. So
congratulations.
I've been working with Medicare specifically since 2020. COVID happening, life changed. I've been working with seniors and the disabled since 2007. So my background really does help with what I do now. I was a diabetic shoe lady around here for about 1.5 years. I used to come to your home or go to the building where you were. So and I know a company that still does that. So if anyone is interested in diabetic shoes and being delivered to your home, I can help you with that. After that, I worked with hospice for about 2 years. I was the person setting up my team to come in with the family and the loved one. And then I went into home care for about 12 years. And then I came over here. So I know a lot about Medicaid as well. And there are a lot of folks out there that have both Medicare and Medicaid. And there are plans out there under the Medicare Advantage C plans that we talked about that offers a whole lot of extras when it comes to groceries and helping with utilities, helping their silver sneakers. It's a gym membership. They can go to as many gym memberships as they like. But there's a lot of benefits out there that a lot of people don't know about.
All right, 317-972-3008. Again, that's 317-972-3008. And give that number for your contact one more time.
Okay, to contact me, again, Michelle Latimore is 317-378-7420. Again, 378-7420.
All right, we're going to take a quick break and we'll have more with Michelle. She's pushing back like she's done, y'all. We have some more to come with Medicare 101. We'll be back after this.
Indeed, the legends of gospel are coming for one night only. Donnie McClurkin.
Yeah. Oh, well, I don't know about that. Oh, okay, good. Okay.
Lauren Sass.
Okay.
Hezekiah Walker.
YouTube and Facebook.
Thursday, February 15th.
Yeah, we're on Facebook,
All
on
3 of the
YouTube.
most iconic voices in gospel music. Get your tickets now at the Close Hall box office and Ticketmaster.com. Donnie McClurkin.
I can't see how many people are in and what they're saying.
Marvin
There might be
Sass.
some questions on there.
And Hezekiah Walker. 3 incredible acts on one stage. Mark your calendar and get your tickets to experience the Legends of Gospel with Praise 1310, 95.1 FM, Indy's Inspiration Station.
Quality care, remarkable people. Eskenazi Health is looking for dedicated professionals who have a passion for their community. Named as one of the best employers in the state by Forbes magazine. And the #1 health system in Indiana for community benefit by the Lown Institute. Eskenazi Health provides excellent benefits, competitive pay, and unwavering leadership support. Learn how a career at Eskenazi Health can benefit you by visiting eskenazihealth.edu/careers.
At Lowe's, save big every day when you buy in bulk. Save 15% on select Sanctuary by Green Fiber blown-in insulation when you buy 30 or more. And there's more. Save 10% on select OSB sheathing when you buy 68 or more. Visit us in-store or online for low prices on the materials you need. Lowe's knows savings. Lowe's knows pros. Selection varies by location. While supplies last. Discount taken at time of purchase. See sales associate for details.
Best wishes to all this holiday season from the Jimenez Mr. Discount family. Remember, at Jimenez Mr. Discount, we are always getting new products in stock. Best deals in town, no joke. Enjoy these great deals to help you start the new year. Standard laminate flooring, 85 cents per square foot. Waterproof vinyl plank available in Avalon, Redwood, or Laurel color styles, only $1.50 per square foot. Bryant Collection, Breeze Color, $1.20 per square foot while supplies last. Come see the new Jimenez Mr. Discount brand flooring. Our flooring is 100% made in the USA. High quality flooring available in many styles and colors to choose from. Also deep discounts on washers, dryers, refrigerators, mattresses, and more. Come visit one of Jimenez Mr. Discount 2 indie locations to start saving today. One at 6425 English Avenue and store number 2 at 5110 West Pike Plaza Road inside the shopping center. Call us at 812-603-1319 or at 812-603-2902.
All right, we're back, and it's a beautiful Saturday afternoon down here in Indianapolis Monument Circle, our new studio. And it is just wonderful, and we have so much space, and it is just so nice down here. And I'm joined by Michelle Latimore, who's talking about Medicare. You might see her pop up around town in different places where she situates herself to share with you information that you need to get connected to the healthcare that you need. And her fiance James is here he's sitting over back in the cut over there. Congratulations to you all. They'll be getting married, and at least James he'll have the front row seat when he turns 65, so that you'll make sure that he's not penalized.
Absolutely.
So what I wanted to do, Michelle, is and those of you who have questions, if you have any questions about Medicare, today is the day to call 317-972-3008. Again, that's 317-972-3008. If you have questions about Medicare, you can call today, and you can set up an appointment with Michelle so that she can tell you all the things you need to do so that you can get signed up. But I just kind of want you to walk us through it. If someone is turning 65 next year, or maybe someone is 64 and they're listening, what they need to do now.
Okay. So, again, 3 months before your birthday month, Social Security should send you your Medicare card. If they don't, I would call Social Security and make sure that they're sending it. Again, it's been a little different with COVID happening and whatnot. Things have been a little slow, going back to normal. So I would contact Social Security because, again, if your birthday is in March, you should have gotten your card in December. Yeah, in December. Then after you get your card, then it depends. If someone is not going to be retiring for 3 or 4 years, they don't have to because they have credible insurance through their employer. Let me say something about that. Credible insurance, you have to call and make sure that you have, if you're with a small company that has, I believe, 10 employees or less, you might not be considered credible insurance, and you have to call Medicare in order to find that out. Okay. Make sure you have your Part A. You have to apply for your Part B. I actually have applications, or I actually go online with people to apply for Part B. Not hard at all. Also, if you're working, when it's time for you to retire and it's past your 65th birthday, I have forms. You go online, you can get forms in order to be able to have your employer prove that you had credible insurance. You have to have that, and then you receive your card with Part A and Part B. That is like your Social Security card. Mm-hmm. It's illegal to laminate it. So don't laminate. I have these plastic sleeves.
Illegal, you said.
It's illegal. Yeah, okay. It's illegal.
Oh, good information.
So I have these plastic sleeves that I make sure that when I meet with people to put their card in there. Actually, if you get a Medicare Advantage plan, your Medicare card should stay at home in a safe like your Social Security card. If most people do that. Mm. But sit down with someone, have a Medicare 101, talk about some of the things that you would like to see in your plan. With Medicare, you have both traditional Medicare, then you can get a Medigap plan. Traditional Medicare covers 80%. Mm-hmm. So we are responsible for 20%. No matter what, everything go across the board. Hospital, doctors, outpatient, everything, we pay 20%, which could be very, very expensive. Mm-hmm. So then you have the choice of getting a Medigap, Medicare supplement, is another term for it. That takes care of the 20% that Medicare doesn't cover, okay? That has a price tag, though. That price tag could be, when you're 65, let's say non-smoking male, that could be about $125 a month. Female, about $99 a month. Each year, it goes up a little bit. I had someone that I just talked to that's 82, mm-hmm. paying, their amount is going from $350 to $402 a month.
Really?
Yeah, very expensive. Plus, you still pay that Part B, $174.70.
So you're up almost $600 a month.
And then you still have a prescription drug plan that you have to have. So let's tag on another 100 was the prescription drug plan because they had several medicines. If you have several expensive medicines, that can have your prescription drug plan be a little bit more. Mm-hmm. So we're up to 7. Then we still don't have dental, vision, and hearing in there. Mm-hmm. Okay. So then, again, that's why the insurance companies came on board and said, we can give you all of that in this pretty little package. We'll do your hospital, your doctors, your dental, vision, and hearing. We'll even take care of some of that 20%, not all of it, but some of that 20%. You'll just pay co-pays to us. You won't pay the whole 20%. And that's what a Medicare Advantage C plan does, mm-hmm. which now, again, most of them have $0 per month premium. But you pay $90 to go to the emergency room, or the emergency room, $290 for ambulance, MRI $290. So you have co-pays.
And these costs are certainly lower than if you got stuck with the whole bill.
Absolutely, yeah. Absolutely, I mean, for sure. Example: my father unfortunately passed away last year, and they have an Advantage plan through his employer. He was in the hospital 48 days. Mm-hmm. His bill came to Mom $647,000. $647,000. What's 20% of that? $128,000 is what she would have had to pay. The plan Daddy had, she paid $1,250.
Wow!
Come on.
That's fire up the ham and people.
And you pay
cut the rug right there.
$50 a month for it.
I mean, that's for somebody that doesn't have the right plan. Mm-hmm. That's devastating.
Very devastating. She would have, she'd be here with me.
20% of that
would have been $128,000.
That's a lot. Mm-hmm. And then if someone does get stuck with that, do they set up payments?
Oh yeah, you can set up payments with.
But that's still gonna be a long time. That's like a house.
Absolutely. Yeah, absolutely. Yeah. Now, if with the Medicare supplement, she would have had the same. Actually, with the Medicare supplement, she would have not had to pay anything out of pocket for that bill, but she's paying whatever it is that month, whatever it is for him. Daddy was 70, he was a smoker, so it probably would have cost about $300 a month for him to have his Medicare supplement plan if he would have did there. But I'm glad that they stuck with his insurance through his employer.
So, Michelle, you have somebody who is turning 65 next year. You would have them get signed up for the Part A, which is free. Mm-hmm. And then the Part B. I mean, how far do you go with someone to make sure that they're covered? Certainly, we hope that they would not end up in the hospital like that, but it is possible. Mm-hmm. So perhaps someone, especially pastors generally don't have much of a healthcare plan. Okay. Except for Jesus.
That's plan.
That's the best one. But except for a miracle, if you ended up with a situation, like your dad, his job provided that.
Mm-hmm.
So people working with you, how would you set them up so that they could have a similar outcome like your dad and mom did?
Well, if you don't have if you're not able to get your insurance through your employer when you retire, then there are like ancillary products that I work with, like hospital indemnity plans, cancer plans that you pay not a couple pennies, but $20 or $30 to be able to have like that hospital stay, $375 for the first 5 days. It would cover that.
Mm-hmm.
You know, if unfortunately you were diagnosed with you know, a type of cancer, it would take care of some of the chemo, radiation, things like that. So there are some different type of plans that you can get to help with that. But there's going to be out of pocket costs no matter what.
Yeah.
I want to mention prescriptions. Prescriptions can be, this is my third year, but my first year really being introduced to prescriptions and the insulins and some of these brand name and preferred brand name drugs. They are so expensive per month. And
Mm-hmm.
we just have to make sure we take care of our bodies as much as possible if we can.
Yeah.
You know.
I always tell people you are your best healthcare provider. Take care of yourself.
Absolutely.
And people do that in January and February.
And March.
March.
It's April we kind of changed. We kind of changed in April.
Yeah, you probably see it all the time because you go around to different places and you see people kind of, certainly the gyms are going to be packed in January, February, and March. And then once the weather starts improving, people kind of go back to their old evil ways, if you will.
Absolutely.
But you've got a lot of stuff there. And before we let you go, I want to give you an opportunity to share some pertinent information that we certainly don't want to let you go and you didn't get to share.
Okay, just a couple important pieces of information. If someone is struggling financially and it's hard for them to be able to get their health care with Medicare because of the out-of-pocket costs, you can always apply for Medicaid. There's some people that don't even know, but you can apply for Medicaid over 65. For 2023, the amount for one individual is $1,215 a month in the home, in an individual home. They give you $20 over, so $1,235 for the month. You qualify for full Medicaid. So you get basically that Medicaid pays what Medicare doesn't pay. The best two insurances, traditional Medicare and traditional Medicaid. Wonderful. The only problem with that is you get older, there's no dental, vision, and hearing with those two really. You have a little bit with Medicaid, but not much. Mm-hmm. And then these dual plans that offer the Medicare and Medicaid together, they offer a lot of extras. Like as I mentioned earlier, one plan offers $250 toward groceries per month, or over-the-counter household goods, personal products. They offer the silver sneakers for the gym, and they offer Fitbit, and they offer the I fall and I can't get up type of necklace or bracelet. Those things are expensive, plus they also cover the monthly cost for them. And then their dental, vision, and hearing is pretty beefed up, so you get a lot of assistance with like dentures and implants and things. So if you don't qualify for Medicaid, though, there's something else, and a lot of people don't know that. It's called the Medicare Savings Program. The Medicare Savings Program is through Medicaid. It's called Medicare, but it's through Medicaid, and Medicaid will pay that Part B for you, that $174.70. And the minimum amount that you can have is $1,843 as a single person. Coming in monthly. Most people would think that's way too much, that they're going to even help me. And yes, these are numbers from 2023. Could not find 2024 as of yet. So it's going to go up a little higher. But between 1215 and 1843, if you fit in there, you could at least get your Part B, $174.70, paid for by the Medicare Savings Program. And that's huge. I've helped several people, and I'm their angel. Yeah. Also, one last thing regarding the fraud, Medicare fraud. Everybody calls. You have all of these online companies calling, what do I want to call it, like customer service agents calling, and I wear a button, and I don't know if you can see my earring, but it's a Medicare. You have to say something to me first in order for me to speak to you as an agent. It's illegal for me to say something to you first. You have to give me the opportunity, and so I do this so that you can say something. Well, calling on the phone, they can call and do whatever they want, and they can change you just by asking you a few questions like your name, the last 4 digits of your phone number, and you can automatically be switched to another plan. So Medicare will never call you. Social Security will never call you. They'll mail you things, but they will never call you.
That's good information.
Yes, so agents like myself have complained, and so the FCC has agreed we have to prove that this is happening. So in order to do that, it's called the Do Not Call list. And the phone number is 1-888-382-1222. Again, 888-382-1222. Call this number, get on the Do Not Call list. After 30 days, if you're still getting a lot of phone calls, send in an email to the FCC at consumercomplaints.fcc.gov. Again, consumercomplaints.fcc.gov, and phone calls should diminish after about 60 days. I test pilot this with my mom. She's in the Gary area, and she gets about 35 calls a day.
Wow.
Because they think she has both Medicare and Medicaid. They go by zip code. And she tried this in July. By September, they went down about 50%, but not enough. So Mama sent in an email, and she just told me yesterday that the phone calls were nothing like they used to be last year during AEP, and she hasn't had a call since December 7th. So this does work.
That's a lot of calls.
I'll leave that with you.
Thank you.
Yes.
Michelle Latimore, 317-629-2415. Again, for those of you who are listening and you want more information, 317-629-2415. 317-629-2415. If you are about to turn 65, or if you're 2 years out, or 1 year out, Michelle can get you scheduled for a consultation as to what you need to do. And she's got an email address too. Michelle, let's see, we're going to go with the Elevate Life. Elevate Life hs@gmail.com. Again, that's Elevate Life hs@gmail.com for health solutions. Live well on purpose. That's your tagline.
Live well on purpose.
Live well on purpose. And you have to be intentional.
Yes.
You have to be intentional about these kinds of things. And as you've indicated, if you work 10 years in the United States of America, you qualify for Part A.
10 years or have received at least 40 units. It should be 10 years, but sometimes it might be a little bit
40 more. Units.
40 units of working.
Yeah.
Yes.
All right.
Mm-hmm.
So, and I mean, people have earned it. I mean, if you've worked, and I've worked since I was, of course, I had a paper route. Yeah. They won't count that. But, in fact, you can't even get those anymore. But I started working when I was 15.
Okay.
I got my work permit. And my first job was at the Waffle House on High School Road.
Okay.
On the west side. I was a busboy. And I've been working ever since. I've been paying taxes. Of course, you have to pay taxes so they can know all these things. So I know that I qualify. And I would encourage you, those of you who are listening, to get it. You've earned it. You've earned it. You shouldn't have to. A lot of times, Michelle, I think people say, well, I'm not going to get sick. If they haven't been sick up till now, and hopefully you don't. Hopefully you don't have an issue. Hopefully you are well. If you've been taking care of yourself, you're probably going to do all right. But if you haven't been, there might be something there that happens to you. And if you're already on this program, and even if you don't think you need it, I think it's kind of like just having some flashlights around just in case the power goes out. I would say.
Absolutely.
You know, you don't want to wait until the power goes out and say, oh, I'm going to go down to the drugstore or the hardware store and get some batteries and some flashlights. Be prepared. And I think this will prepare you if you're at that age. If you are 64, about to turn 65 in 2024, even if you, especially for those of you who have received your card, don't throw it away. Don't put it on the stack of papers or use it as a coffee mug. Get on that thing and get yourself together, and you can call Michelle Latimore. You've got another number here for me. All right. 317-378-7420. Again, 317-378-7420. That number again is 317-378-2420. Put you in contact with Michelle Latimore. And if you don't want to call on the phone, you can go to elevatelife@gmail.com. That's elevate life, the letter H, the letter S, @gmail.com. And Michelle's going to get you connected to everything you need with regard to Medicare. Do you have anything else?
No, I think that's pretty much it. Just making sure that people are not afraid of Medicare. Again, it's different, but we have to do it. There's no other insurance out there
Do
but
people feel
Medicare.
some kind of way about Medicare, like because you know it says for old people? I think people think that.
Yes, they do. They do.
But 65 doesn't mean you're old.
No, but I mean, you can also have Medicare if you're under 65. If you've been on disability for 2 years, you can have Medicare as well. You sure can. After that 25th month of being on disability, you qualify for Medicare. And typically, the card is usually just sent to you and you're surprised because people don't know that they are.
Well, to God be the glory for the good folks over at Medicare and Social Security who are tasked with taking care of people. Yeah.
One more thing. I would like everybody to know this. Medicare is open 24 hours a day, 7 days a week. I don't know if it's open on Christmas, but 24 hours a day, 7 days a week. Medicare is our friend. We seem to be afraid of it, but it's our friend when we need it. And the phone number for Medicare for any questions, if you have questions about your own Medicare, if you have a loved one that's in a facility and you feel like there should be more done, or if you're having problems with anything in the medical realm, 1-800-633-4227 is Medicare phone number. Again, 1-800-633-4227. Everyone will call on a Monday or Tuesday at 8 a.m. and wait 7 hours and be upset and then don't want to deal with Medicare. But again, it's 24 hours a day, 7 days a week.
All right, get on the phone, y'all, and get a hold of the people who can help you and at least have this in your back pocket, even if you're healthy and don't think you need it. My dad, who passed in 2020, he was an insurance agent for all of his life for the most part. And he used to say it's better to have it and not need it than to need it and not have it. That was one of his sayings. All right. So we're going to reset here. Michelle, thank you. You've been a great guest.
Thank you for having me. I really appreciate it, Pastor.
You're welcome. So. And perhaps we'll have you back again at some point.
Absolutely.
Stay with us. We have more to come. We'll be back after these messages.
Okay? Yeah? Okay.
I'm happy, I'm joyful, because my 3-year anniversary is tomorrow. I be wanting to start fights for no reason. The house too quiet. The house needs some. She ain't having it. She don't want none. Man, Lord, thank you for getting me a girl Boaz. I'm so grateful. What? The girl Boaz, you know, obviously the young in the Boaz. I got girl Boaz. So that's why. Listen, we love it. Them love talks, they got me together. On Praise AM 1310 and 95.1 FM Indy's Inspiration Station. What's up, family? This is Pastor Mike Jr. I'm asking you to support St. Jude Children's Research Hospital because they give kids with cancer the chance they deserve. Families never receive a bill from St. Jude for treatment, travel, housing, or food so they can focus on helping their child live.
Give thanks for the healthy kids in your life and give a gift that could last a lifetime. Donate now at stjude.org or give wherever you see the St. Jude logo.
What's holding you back from learning the language you've always wanted to know?
Too hard.
Takes too long.
Not with Babbel. Babbel's lessons take just 15 minutes a day.
15 minutes isn't long.
Nope. And they're fun. So you don't realize you're learning a language, but you are. In 3 weeks, you're able to start having conversations. And Babbel's lessons are built around real life.
And with Babbel, it isn't hard.
It's perfect.
Start learning a new language today. Go to Babbel.com. That's
The
hustle
got.
and bustle of Christmas
I was
is
just
over,
keeping
and
it.
it's time
I
to
was
treat
keeping it
myself
extra
for all of my hard work.
for
Of
the gas.
course, I went to Kohl's, and boy, I'm glad I did, because it's their biggest clearance event of the season. I saved 70% on a cute pair of jeans, a cozy sweater, and some comfy PJs.
Hey, Rita,
Going to
you
Kohl's
all
is
right?
just relaxing.
Good to see you.
Gotta get back in the holiday
Good to
spirit
see
for
you
New
this
Year's.
afternoon. I'm doing good.
You look good. January 21st. So it's
We on our way.
Hold on a second. Let me.
We got 20 seconds.
Okay.
address the healthcare disparities within the Black community with trusted voices and information to power a healthy lifestyle. The Black Health 365 podcast, the Urban One Podcast Network. Listen and follow wherever you get your podcasts and urbanonepodcast.com.
All right, welcome back to Unity in the Community. I'm your host, Pastor James Jackson. Good to have you all with me on here. And those of you who are streaming, good to have you in our listening audience. And we just shared with you some very important, pertinent information with regard to your health. And if you are turning 65 on next year, 2024, or if you're 65 now, be sure that you avail yourself to all these free services. At least some of them are free. And you can, again, give Michelle Latimore a call at 317-378-7420. Again, that's 317-378-7420. Or you can email her at elevatelife@gmail.com. That's elevatelife@gmail.com for more information on getting you connected to Medicare. So I want to kind of stay in that vein right there. And for those of you who are listening, you can give us a call at 317-972-3008, 317-972-3008. As we talk about healthcare, that's our topic on this afternoon. Certainly there are going to be a lot of people getting into the gyms and perhaps even now buying gym equipment, physical fitness equipment, trying to get in shape for the new year. I always tell people don't stop so you don't have to start over. But if you are starting over in January, then you want to make sure that you get the right stuff. 317-972-3008. For those of you who are in our listening audience, give us a call and talk to us about your particular fitness plan. What are you doing to go into the new year to get fit? I want to encourage you to do a few things. I want to encourage you to make sure that you're drinking plenty of water, get more sleep, be sure that you're getting off of the seat, getting off of the couch, if you will, moving around a little bit. There's a lot of devices out now. You've got Fitbits, you've got wearable things that will help you so that you can be healthy. 317-972-3008. We got Larry. Larry, welcome to the program.
How you doing, Pastor Jackson?
Good.
You know, as I look around over the last years that I've been here, the main thing that people have trouble with, they fall into when they get a little money and a little security behind them, they fall into gluttony. More people are going to the cemetery because of that fact, you know, and it's not going to get any better because people I think it's a curse, you know. The people, they can't control their mouth, and the thing about it is that should be an easy thing to do. All I remember is that the older you get, the less food you should consume because you know that has a bearing on your digestion and everything. And you sit around sluggish, and then people complain about feeling pain and so forth and being overweight. Well, they're doing it themselves every time they run into the convenience store and get a big Mountain Dew topped off and drink that. That's just like eating a cup, 2-3 cups of sugar. So, you know, people, you talk about healthcare and all this stuff. I admitted that I hadn't been into the hospital for about 30 years when I went to have my operation. And, you know, I have not been back with a serious problem because I don't eat garbage and I try to keep active. But I think the main thing that's facing the black community being glutton, joking and laughing about eating barbecue or going to have a steak dinner. The steak is the worst thing you can eat, Pastor Jackson.
Mm-hmm.
When you eat that, it stays in your system for 2 or 3 days. It rots, and toxins pervade your whole system. So I think people just need to take a look at what they're eating and consuming, and that's their New Year's resolution, to stop eating garbage.
All right, Larry, thank you for your call and comment. Certainly that is the key. We are what we eat. And one of the things that we have to make sure that we're doing is choosing the right foods. Not everything is fit for consumption. And most people, most of those of you who are listening, you're probably, when you're out, going to get something out. You're going to go to a fast food restaurant. Drive-throughs are always long lines, especially at places like Chick-fil-A and Starbucks and places like that. Some of these folks or these businesses do have some healthy items on the menu, but there's a lot of stuff out there, as Larry indicated, where people are getting these Mountain Dews that have a lot of caffeine, lots of sugar. I was watching something on History 101 on yesterday. They were talking about fructose, when fructose, corn syrup, and all of that first came on the scene. And Americans started becoming more obese because a lot of the food and beverages had high fructose. You see it on the container or the package where it would say that. There has been some regulation trying to reduce these kinds of things, but you have to watch out for it. You have to put the work in. You have to be aware of what you are eating. There are some great apps out there. I use one called Fitness Pal, and I was able to lose quite a few pounds this year. I was at about 200, which is not bad. Not bad, but I wanted to get down to 185. I'm currently at 183 and holding. But I was 185 pounds when I graduated from high school. So I'm back down to my high school weight, and that was my goal. 30. I think my waist is about 32 now. You can do it, and you have to do it every day. You have to be consistent with it. You're not going to see results in the first couple of days. You may see some results in the first week, but even in the first couple of days, you're going to feel different. You really get a new body every few months because everything is renewing. The cells in your eyes renew every 2 to 3 days. So you kind of have new eyes every 2 or 3 days. And that's what happens all over your body. The cellular activity is taking place. New skin. Your skin sheds. You may not see it. Probably don't want to see that. But you're shedding skin all of the time, which is the reason why you should change your bed linens and different things like that and deep clean your house. But we are constantly being made new. And so if you start January 1, I'm not going to tell you to start today. Is this live? Yes, we are live right now. But start on the 1st of January. Eating right, drinking more water, eliminating some things from your diet. Get that Fitness Pal app and track your calories. And really, that is the essence of it all. You have to burn more calories than you're putting in. And if you think about it, you could be consuming 4,000 to 5,000 calories a day and not really be aware of it. One meal could be about 1,000 calories for breakfast. And then if you have lunch, that's another 1,000. And then if you have snacks, and then if you have dinner, so you could be up around 4,000 to 5,000 calories pretty easy. And every 1,300 calories equals a pound. And at the end of the day, if you've consumed 4,000 or 5,000 calories and you've only burned, let's say 1,500, then you are over quite a few calories. And that's how the weight stacks up, because what your body does is it stores all of that excess and it turns into fat. But if you start monitoring, and what you monitor and measure improves, and if you start monitoring how many calories you're consuming, and you monitor how many calories you're burning, there are all kinds of tools out here now to help you monitor that. And for me, on the Fitness Pal app, I'm set at about 25. I think it's about 2,500 calories a day to consume. Might be 26. And then, of course, to get down to that 185, I started doing 2 workouts a day. You may not think you have time for that, but you have to make time. Get up 40 to an hour early. Monday through Friday. Just do it through the week. Get up 40 minutes earlier. That's how you make time. Because you may have a busy day. And instead of just sitting around for lunch, walk up and down the stairs in your office, or if there's a gym close, bring some clothes. There's just all kinds of things. You have to be intentional. You have to plan for it. Because after you turn 40, and after you turn 45, and after you turn 50, and after you turn 60, your metabolism slows down. And you may have all the best intentions, but when your metabolism slows down, then your body metabolizes the food that you consume much slower than it used to, which means that you're probably not gonna burn fat, or burn up calories, I should say, as quickly as you used to. How many of y'all remember we could eat all we wanted to? It didn't make any difference. If you put it in your mouth and it was edible, you just eat whatever you wanted to, and you didn't gain a pound. But now, and especially nowadays, because everything is so processed and everything is so artificial, you have to be intentional. You have to make sure that you are looking out for yourself. You are your best healthcare provider. Take care of yourself. I'm going to bring some folks in here who can help you. I'm going to bring some folks in here who are going to give you information. There's folks who do CMOS, and they do teas, and they do all different kinds of things like that. I'll be bringing them in. Fitness people. In January, it's just going to be fitness month. We want to help you get fit, help you get healthy, so that you can live your best life. Thank you for being with me on today. We're here on Monument Circle. Thank you, AJ, for being on the controls. Thank you, Michelle Latimore, for all the information you shared with us. We've enjoyed our time with you, from all of us here at Praise. I got to get used to saying this. Praise Indy's Inspiration Station. We like you, we love you, and you make us smile. Have a great Saturday. Have a great weekend, and Happy New Year.